Hi, my name is Greg Fell. I'm Director of Public Health for Sheffield. They asked me to say a few words about social distancing. I keep being asked. I'll distinguish here between physical and social distancing. We all use the term social distancing, but it's the physical distance that matters. How far? 6 feet. And the point is to limit the number of opportunities that the virus has to spread, to slow down the course of the epidemic, and actually to dampen the number of people that ultimately get really poorly. Why? Because it protects capacity within the NHS. The NHS and social care are pulling out all the stops to enable themselves to care for people when they become really, really poorly. And we need to do all we can to limit the opportunity for the virus to spread. I know that today there will be groups of young men in groups around Sheffield. When we say stay at home, it means stay at home. It doesn't mean go to the DIY shop. It doesn't mean go to the park in groups of 50 or 60 people. It means stay at home. I'll kind of end with the words of the Director General of the World Health Organization said a few weeks ago. I, as an individual, I can take a chance on whether or not I want to carry the risk of getting this virus. We'll all get it eventually. Oh, most of us will. But I take the chance of whether or not I want to become poorly. But by acting by mixing in big groups, you're facilitating the spread of the virus, you're speeding it up, and you are creating a pressure on NHS and social care. Particularly the pinch point here is going to be intensive care. If intensive care is full, that has consequence for the people who can't get intensive care, and that means lives are lost. That could otherwise have been saved. So whilst I may choose to take a chance, or you may choose to take a chance, there's a really important point about being mindful of that your choices impact on the lives and potentially the deaths of others, and I think we should all think about that.